First of its kind women's health research initiative is now underway. It will bring together private and public sectors to close research gaps and improve women's health. Here to talk more about this important initiative and how it will help things, we have Dr. Dana Bitner in studio with us again. Thank you so much for being
Good
here.
morning.
So it's 2024. Before this year, another significant year, if you can believe this, 1998. Why is that?
It was a revitalization act of the NIH, and what they did is finally make it law that medicines used by women were studied in women.
Wow.
And what kicked this off was that whole Ambien debacle, that Ambien is a medicine used for sleep, and the dose for women was much lower than in men, but it only had been studied in men. So there was a lot of harm caused with issues with women. Anyways, that's what kicked it off. So the good news is now finally women are included in studies. And you know, the first thing that really to me was a stark difference is women develop heart disease different than men. So women would have different symptoms. We tend to get shortness of breath with exercise. And so what happened is the test to look for heart disease in men didn't show the heart disease in women. So women were told, oh, you're just anxious. But no, they were actually having heart attacks. So they'd go home and die of a heart attack. So Dr. Merz and the NIH created a whole group of studies called the Y studies that looked at that. So now we understand how, again, women develop heart disease differently.
Sure. And we've seen, you know, we talked about this in February, the Go Red for Women and the emphasis on, you know, women and how heart disease affects us. So good to see that awareness finally coming through. And also, not just heart disease, I mean, autoimmune diseases as well, the way that these affect women much differently than men. Some of them can only be found in women, like endometriosis. We talked about that too.
Yeah, and what's so exciting about this initiative that Dr. Jill Biden has driven, and it's been signed into executive orders, it's bringing more money, again, with private sector, with venture capital, with academia, all together to drive research around endometriosis, rheumatoid arthritis, lupus, all these things that tend to affect women more than men. And you know, my patients will joke, if men had these, they would be fixed earlier. So no disrespect, but yet it's really good to see that this is getting a lot of attention.
Yeah, also menopause, we talked about that quite a bit as well.
We did, and so, you know, Jane shows us the example of Jane was suffering through, you know, menstrual migraines that were affected by hormones, weight gain that just didn't make sense, fatigue, all these symptoms that she was just told, oh, deal with it, it's just part of getting older. But actually there are solutions, and we now understand how much estrogen changes affect weight, affect headaches, and it didn't take much to get Jane feeling better, and she's like, why did I have to suffer? So it's really exciting that healthcare is going to really push along and normalize the conversation.
Sure. And so what is the takeaway tip then?
The takeaway tip is if you have symptoms, don't blow it off. Don't take no for an answer. Don't take that's just part of aging. Like, keep pushing. There are people out here that know more. So look for a certified menopause provider. Look for a provider who understands how women's health is different than men.
Sure. And hopefully
don't settle.
Don't settle. And knowledge is power. I love when you say that. Hopefully this new initiative will lead to greater awareness, greater breakthroughs with women's health.
Exactly.
Thank you so much for being here. Appreciate your time as always.